A little bit about me. I'm Dr. Schroeder. I'm a physical therapist with Back at Work Physical Therapy. We have clinics in Clearfield, in Logan, and in Tremont. And what I wanted to share with you today is a treatment that's newer in Utah, being utilized by physical therapists to treat back pain, neck pain, various types of pain that comes from problems with our soft tissues, anything from our muscles, ligaments, tendons. Now can you see if you can shut that? Those blinds that sun's right in my eyes. Soft tissue conditions. Everything from, like I said, the common things like back pain, fibromyalgia, even common joint pain can be treated with it. And so it's one facet of treating chronic back pain that's becoming more and more utilized in physical therapy, utilized mostly by physical therapists, although some medical doctors, DOs, physician assistants, nurse practitioners are being trained in it as well and are doing it as treatment for their patients. So that's what I'm going to talk about today, is mostly the dry needling. About dry needling, well, let me go back a little bit in history. Anyone have any idea how long acupuncture has been around? A long time, at least 3,000 years it's been used. And that originates mostly we think about that originating in the Orient, China, those type of countries, but there's even evidence it being used in Greek civilizations, Romans, and things like that, using needles to treat the body in various ways. Acupuncture is different than dry needling in that it is performed by an acupuncturist, someone trained to understand the oriental view of the body. Looking at, from their point of view, how the body is treated with needles, herbs, various different things to try to optimize health. And that's what acupuncture, that's one of the main definitions of acupuncture, is that it's performed by an acupuncturist trained in Oriental medicine. Now there's a number of forms of acupuncture. Actually, there's 80 to 90 different forms of acupuncture, which is surprising. But like many things, people start to do it and they create different twists on it. They discover different maybe ways to do it, and so you have lots of different forms of acupuncture. Now, in about the mid-1900s, some medical doctors started to look at acupuncture, and they started to play around with treating muscles that are all knotted up and painful muscles with acupuncture needles, with injections and so forth. And so dry needling has more come out of that that study, that approach that was started by medical doctors, looking at the way acupuncture benefit people, but putting more of a modern Western medicine type of approach to it, or spin to it. An interesting little story about treating these muscle pains and so forth is one of the pioneers in this kind of treatment. Her name was Janet Travell, and she was actually John F. Kennedy's personal physician. And he had back pain so bad that he was getting cortisone shots 2 or 3 times a day in his back. And she was just learning and these techniques and experimenting basically on him, treating her patients. Well, his back pain was so bad that he would get these shots all the time. And also he'd wear a corset, a lumbar brace, most of the time too. And historians believe that's one of the reasons why when he was assassinated, that he actually was killed, was because he was wearing a corset. His back pain had gotten so bad that probably because he had, in some ways, too much cortisone injected into his body, that he was wearing this corset at the time that he was shot, and instead of being shot and collapsing, he stayed upright because of the corset, and that allowed a few more bullets to hit him and kill him. So anyways, just an interesting story about the beginnings of the trigger point and muscle treatments used that kind of came out of acupuncture a little bit, and the injections, and it's progressed, and now doctors use these injections pretty commonly, but they don't do them nearly as much as 2 or 3 times a day. It may be 2 or 3 times in a year that you get a cortisone shot because they know that it has a bad effect. Now, they started to find that you would get similar results if you didn't inject anything, but you just stuck a needle into a muscle or some soft tissue. In fact, there's a debate going on right now in the medical field as to what's better. A dry needle, okay, which means it doesn't have any medication. You're just piercing the muscle or the soft tissue with a needle, or a wet needle where you're injecting lidocaine or cortisone or something like that into the muscle. So that's where the name dry needling comes. And so dry needling is a treatment that's kind of grown out of the old acupuncture and then modern medicine looking at the benefits of that and then developing the technique from that. Does that make sense? Okay. So sometimes it's a funny name. Do you have any more of those? Let me have them. I just want to be able to reference my, people think, dry needling, what does that mean, Is it acupuncture? No, it's not acupuncture because we don't use the acupuncture philosophies. We don't to locate where you put the needles. We're using more anatomy, neuroscience, neurology, those kind of things to determine where you put the needles, okay? But it is a treatment for soft tissue problems. Now, back pain is the most common soft tissue type of injury that people experience. At any point in time, probably 30 to 40% of people walking around are having back pain. And if you look at your lifetime, 90% of people are going to have an episode of bad back pain at least one point in time in their life. Has anyone in here fallen into that category where they've been down for a couple days because of their back? So it's super common. And dry needling can be a very good treatment to help diminish that pain, get the muscles to relax, and help you go ahead and get back to doing things. That's not as invasive as getting a shot or obviously taking a pain medication or obviously having surgery, something like that, okay? So how does it work? There's 2 mechanisms that we think are going on with acupuncture and dry needling. There's a central mechanism and a peripheral mechanism. What I mean by that, there's reactions that are going on in the body, in the brain, and in the central nervous system in response to the needle being placed in the body. And there's reactions that are going on in the local area where the needle's been placed. Okay, so think about what's happening with the needle when you put it in tissue. Let's say you've got a back spasm, okay, or a neck spasm, or maybe you've got this muscle tension and muscle pain from fibromyalgia or something like that. When you stick a needle into tissue, what have you just done to the tissue? You've just injured it. A small injury. These needles are what are called filiform needles. I'll just pull one out and kind of give you an idea how small they are. Okay. So, you know, the length of, that's a 2-inch needle, but you can see how thin that is, okay, and it's flexible. It's a solid needle. It's not a bored-out needle like you would have if you were to get a shot. So it's very small. This is like 36 gauge, pretty thin. And so when you put it into the tissue, though, because it's sharp, it cuts through the muscle. It cuts through the ligament a little bit. It cuts through the tendon a little bit. And what's going to happen when that happens? You're going to have a inflammatory response, which is the body's natural response to an injury to start the healing process. Okay? Now, because it's a small injury, that inflammatory response isn't going to be huge. Like if you sprain your ankle and you get a lot of inflammation because you have a lot of damage there. So we would call this micro trauma. But you can use the needle to stick into the tissue to start that process, okay? And basically what happens is it causes, you know, a few different things to occur in the body. It causes chemicals to be released in the tissues, which tell the body to send blood flow and to send cells from the immune system to come and repair this injured area. It also sends messages, causes messages to be sent to the brain, and the brain says, oh, we've got damage in this area of the body. What does the brain do in response to that? Well, whenever there is some damage, the brain will, if it's a lot of damage and it deems that as a threat, it might give you pain. But if it's a little bit of damage and it's not as big of a threat, okay, it actually releases chemicals, endorphins and enkephalins and different chemicals that you've heard of that can actually decrease the likelihood of getting pain from that injury, as well as stimulate some healing processes to occur in the body. Okay, so you can almost look at dry needling and acupuncture, if you want to go to that extent, as the practitioner using the needles to stimulate a healing process. So let's take someone who has chronic back pain for 3 or 4 years. Okay, is their body healing that anymore? No, because the healing process ends in 3 to 6 months. Okay, it's done. Usually most people's tissues are healed, and if they're still having pain, that can come from muscle tension, that can come from irritation in the nervous system. Okay, it can come from even the brain being a little overprotective of the person, but they're still having some pain. So if you take and stick needles into a tissue or an area where they're having pain and cause a new injury, then it starts that process again, okay? Not in a major way, but in enough that it can release good chemicals from the body to relax the body. It can release or cause the circulation to start to flow into that area, help the muscle to relax. And when it feels better, what do people start to do when they start to feel better? They start to get back to doing more. And as they get back to doing more, they start to restore their strength, their flexibility, their mobility, those kind of things. So we use dry needling along with our other treatments in physical therapy to help a person feel a little better, so they start to move better, so they can exercise a little bit, and they can start to recover functionally and get back to their life. Okay? So without getting, too technical about it, that's kind of what's going on with it. And that's where it fits into the medical treatment of someone with chronic pain or even with acute pain. Many athletes are using it right away after even a new injury, okay? Because it does trigger some good processes with chemicals in the body and so forth. So, for example, I help with some of the injury care of the Mountain Crest High School over there, because I live over in that area. And, sometimes I'll get a kid who's just sprained their ankle or just pulled a muscle. And we'll do the needling to them, and it gives them a lot of relief, and it speeds up their healing. Professional athletes use it a lot to just maintain their bodies, okay? Keep the muscles relaxed. If they are overusing, let's say, some muscles or tendons, they'll use it to try to not allow that to get out of control. But it's not necessarily usually a standalone treatment in that you just do this treatment and you walk out the door. Occasionally that is the case, but most of the time it's used by a physical therapist to supplement the other things that they would do in physical therapy, exercises, stretching, strengthening, even joint manipulation or mobilization, massage, and all those kind of things to help you feel better. Okay. Does anyone have any questions about how dry needling works or what the role would be? Did you get one of these?
Yes.
Okay.
So with the athletes, Professor, instead of sprained ankle or something, do you think the needling in the ankle?
Yeah.
So it's not just back, it's
Yeah, we do it throughout all the body. And if you see down at the bottom what can be treated, you know, I've listed some of the common stuff, but any kind of a sprain or strain, you know, can be treated with it. So in the case of a sprained ankle or a pulled muscle, you know, it can be done. One thing we also do with the needling is we put the needles in, and sometimes we will use little alligator clips hooked up to a TENS machine. Does anyone know what a TENS machine is? And clip that on to the needles and run that electricity down the needles and through the tissues, which is much more effective than putting electrodes just on the surface and running it through the tissues. Why? Because the electrodes can only penetrate, you know, about a centimeter into the body, whereas if I take a 2-inch needle and put it through, you know, the muscles of your back, I can get that electricity down 2 inches and through the muscles much more effectively. With some of these sports injuries, we're doing needling combined with electrical stimulation, because we know that electrical stimulation has a positive effect on reducing the sensitivity of the nerves, triggering the release of endorphins and things like that that can help with pain control. And ultimately, you know, if you can get better pain control earlier on in a situation where someone's injured themselves, what do they start doing? They start moving better, quicker. And as long as it's not a major injury that would require them to not move, you know, they're going to get recovered faster. So we do use it on ankles, knees, shoulders, necks, backs, elbows, hands. I'll give you an example. I had a kid come in who was working. He was a climber, liked to climb and stuff, going to the university up there. But for the summer, he worked down in Moab, being a river guide. So he's rowing a boat all day long. And by the time he came back from the summer, his hands were just a mess, you know. Constant pain, didn't have any grip. He had developed some tendonitis. And so I did a lot of needling with electrical stimulation through those muscles and some massage, and taught him some exercises. And it took about a month, but he was completely better again, able to climb and do all those kind of things again. So we use it for all kinds of different things. Chronic things like fibromyalgia or just chronic pain, headaches. I use it on TMJ problems. I use it on, you know, sometimes I use it on just crazy stuff that I'm not exactly sure what else to do, you know, but I want to try it. Had one lady come to me who was having a constant earache, you know, kind of right in this area of her ear. And I put needles around the area. I didn't really have a protocol to follow, but, you know, I did needles in the area, some in her jaw joint, around the jaw joint, some of the muscles around the jaw, because I felt like the jaw was maybe contributing to that. And, you know, she'd been dealing with it for years and years and years. The doctors had tried everything. They finally, well, go see this guy, see what he can do. And it took away her pain, you know. So there's a lot of applications and possible things. It's not a cure-all, you know. It's I don't want to paint it as some magical cure and it's going to, obviously, in some cases, it can be a miracle to some people, but in most cases, it's very helpful, helps about 70-80% of the people we use it on, and it's a new treatment that you're going to see more and more physical therapists doing, more and more doctors recommending, because it's new in Utah as far as the state law allowing physical therapists to do it. That was changed so that we could do it about 4 years, 3-4 years ago. So I've been doing it for about that long. And it's, it's quickly become probably one of my favorite modalities to treat people with. I usually try it first if the person is willing to do it. Some people are afraid of needles, and that's okay. We don't necessarily do it if the person doesn't want to, but it's usually something that can be done. I don't know of anyone as far as a physical therapist doing it here in Brigham City. There may be a physical therapist doing it here in Brigham City at the hospital or one of these clinics here. Like I said, I'm up in Tremont 2 days a week, coming over from Logan and doing some treatment there. And then in Logan, and then we have the clinic in Clearfield. So what I thought I would do, if there's no more questions, is give you a little demonstration. Oh, you had a question, yes.
I just had shoulder surgery, and I know when I'm done physical therapy, I hear them talking about having someone come in and needle them. Not me, but someone else. Is that what they're talking? Is this dry needling then?
Yes, if they're saying needling, yeah. Yeah, where are you doing therapy, at the hospital? Okay, so I know that Mountain West Physical Therapy does the therapy at the hospital, and they have some therapists trained to do it. So, they're probably, not all their therapists are trained, but they're probably using someone who is trained to do the treatment when the therapist feels like that's necessary. Yeah.
What's the success rate on nerve pain?
It's not as good as with, muscle pain, but it's pretty good. I would say 50% of the time it's helpful to them. I get, people with sciatica all the time, and I'll treat sciatica with it. That's probably your most common situation that you might do it on. Sometimes what's called radiculopathy, where it radiates from your neck or your lower back. We'll treat that, and I've treated it down the arm. Old nerve pain, stuff that's been around a long time. Anything actually that's a chronic problem. The longer it's been around, the more treatment you would need, and the longer the needling would take to benefit you. So if you've had chronic headaches for 20 years, it'll probably help you, but it's going to be like this, for a while. You'll benefit when you have the treatment, and then you'll feel like you're hurting again. Then you have another treatment. You'll benefit maybe a touch longer, and you go through a course of treatment that might be for a few months to help get some control over it. So the more chronic the problem is, the less likely that it's going to help. But it usually will help to some extent, not all the time. Nerve pain is one of those conditions that it can help, but it's not as helpful as it is for other soft tissues, just because of the nature of the way nerves are anatomically. And you can't go necessarily right into a nerve with your needle. You don't really want to do that. It hurts, and it can damage the nerve. So you may only put your needles near the nerve, and you're hoping the blood flow that is triggered by putting the needle there is gonna, affect that nerve, but you're not. Whereas if I've got a knot in the muscle, I can go right into that knot and treat it directly. So, any other questions about application of it? If you don't, I'll show you a treatment. We'll take Scott here, unless someone wants to try it. If anyone's willing or wants to try it, I can do, a couple muscles in your neck. We've got a little, chair here that you could lay in. Otherwise, okay. All right, come on up here. We'll just set you right there, okay? Go ahead. Do you have some neck pain? Okay. All right, so just go ahead and lean forward there. Is that comfortable? Go ahead and actually unbutton the top couple buttons there, and then we'll roll your collar down a little bit. There you go. Let me get it out of the way. A common cause of headaches is muscle tension here, okay, from bad posture, stress, and other things. So there's what's called the suboccipital triangle, which is a triangle of muscles here, and they can cause a lot of problems. And then you've got the joints underneath that between the skull and the first vertebrae and the first and second vertebrae, which cause a lot of headaches too. Do you have any headaches?
I get a lot of headaches, and I've had a little bit on the left side, which has been
Yeah.
quite a while. But I have a hard time turning
Okay.
my head around.
Yeah, so let me treat this side of your neck, okay? And I just, feel around for where the tension is. He's got a little bit of a knot here and some tension there. So I'm going to put a few needles here and then a few down here and then into this muscle. So let me put a couple gloves on. So the needles that are used are these sterilized, individually packed needles. They don't get used more than once on a person. Because they're sterile, you don't have to sterilize the location. And because the needle's so small. So I put a few needles there. Can you feel anything with that? Any pain when I put those in? They're so small that it's not like getting a shot. People are like, oh, I hate needles. They scare me. Well, that's because shots hurt, because they're big needles. Compared to these, a needle that you use for a shot is like 10, 20 times bigger than these small acupuncture needles. Occasionally a needle will, cause a muscle to twitch, and you'll get a little pain with that. Occasionally a needle will pierce through a small blood vessel, and that'll ache a little bit. And occasionally the needle will, if it does pierce the blood vessel, cause a little localized bleeding, and you might see a bruise. But other than a small bruise, there's really no, and maybe some soreness in some people. There's really no side effects that are negative, with the exception of if you're doing your needling around the ribs, you have to be careful not go into through the ribs into the lungs. You wouldn't want to do that. It doesn't happen very often, but it does occur, or it's been documented to occur. So these bigger ones you might feel a little bit more, because they're going deeper. You've got 2 inches, 3 inches of muscle on the back of your neck. So you can put a big long needle into that. And there's nothing there other than muscle. There's not nerves. All the nerves that go out of your neck come to the front. So we'll put big, long muscles in there, or needles into those muscles so that we can get an effect through all the muscles. Some places, you leave the needles in. Some places you put them in and take them out. It all depends on what you're trying to accomplish. But that's not too bad, right? So, we could take some stimulation and clip to a couple of these needles and run a little electrical stimulation through them. And that does usually a really nice job of helping that muscle relax even further. Okay? So in your case, if you were in the clinic and I was treating you, I'd probably leave those in for 5 or 10 minutes because it's been shown, that if you leave them in at least 3 minutes, somewhere between 3 and 10 minutes, you get a better result in relaxation. So, any other questions? Kind of cool. The main difference, the main difference is acupuncturists place their needles based on Oriental medicine philosophy, which basically is trying to manipulate the body's energy. You've heard of the yin and the yang, and they believe that when you needle certain points in combination, it affects the body's energy, which is its self-healing capacity, and it has an effect on, pain or organs or whatnot. Whereas in our case, we also believe the needles are triggering the healing response, the body's self-healing, but we're looking at it more in terms of a physiological reaction, looking at it more from a Western point of view. So an acupuncturist, if he was treating the neck, he might put some in the neck, but he also might put some in the hand, in the feet, in the ear, in these different acupuncture points that they've mapped out in hopes that that's going to help with the person's condition. Whereas most of our treatment is going to be local. If we do put needles a distance away from an area, it's because there's a nerve that runs through there, and we're trying to stimulate that nerve. But it's basically, the main difference is the philosophy of acupuncture versus the philosophy of dry needling determines where you put the needles. And we don't believe we're necessarily affecting the body's energy, which is the basis of acupuncture. But same needles, same technique, sometimes in dry needling, the therapist will manipulate the needles a little bit, spin them, piston them, do different techniques to try to get more of a reaction.
So does this work for things like osteoarthritis?
If it's mild to moderate, not severe. My father-in-law's got maybe moderate knee arthritis, and you can get up. It'll get bothering him a couple times a year, and I'll needle his knees, and it'll go away. But if it's severe, it doesn't necessarily have that much of an effect. You're welcome. But yes, some arthritis will benefit, rheumatoid arthritis, other chronic conditions, can be benefit too. And it's not that the needling is going to heal that stuff, but it can reduce the pain associated with it, to the point where people will use it sometimes as an alternative treatment versus maybe they don't want to take so much medicine. Maybe they're trying to put off having a surgery for a few more years, things like that. Any other questions?
Is it covered by insurance?
Yeah, yeah.
So, I assume that when the patient goes in, they would have a consultation or something,
Mhm.
and kind of determine
Mm-hmm.
whether that would be the right treatment
Yeah,
or not. What
yeah.
type of questions or what determines that you feel like this would help?
Well, the nature of their problem. So, for example, if I determine that it's a muscle, any kind of a soft tissue type of an injury or condition, then this would be something to definitely look at. Or if the muscles are reacting with a lot of spasm and pain related to something else, let's say you have a herniated disc and that's causing you some sciatica, but also your muscles are all knotted up in your back trying to protect you from moving too much, we can use the needling to reduce the spasming so that you can start doing the exercises that can help the disc. So questions about the injury, how it occurred, how it developed, questions about your overall medical state, what other conditions you might have, all might go into determining whether this would be a good treatment to you. The most common thing it's used for is muscle pain. Spasms, trigger points, which are knots in your muscles. You can all feel those trigger points in some of your muscles. Someone pushes on it, it gives you some pain. Those are probably the most common things. Sometimes it's done as just because everything else has been tried and nothing's been helpful, so let's try some needling, by process elimination. Doctors have done the shots, people have had surgeries, they continue to have some pain. The nice thing about needling is it does have an effect upon the central nervous system, as well as the tissues that you put the needles in. We do know that when you stick a needle in a person, it triggers some mechanisms in the brain, which we don't know completely, but it does lead to the release of endorphins and enkephalins and some of these chemicals that have been associated with pain relief. Some of the chemicals that, they're called endogenous opioids. We all know about the opioid epidemic. Endogenous opioids are your body's own opioids. It makes its own opioids. Morphine and all these other opioids that the doctors give have been designed to try to mimic what your body creates. So you have your own medicine chest in your body. And if you can trigger that to produce these endogenous opioids, endorphins and so forth, you can get some pain relief. Needling does that to a certain extent. In some people, it's a very strong reaction, and it's like a miracle to them. In other people, it's more of a mild reaction. But, those are some of the, that's some of the, the background in it that's helpful to know. Some people don't want to take the medications, or they've taken them long enough, they want to get off of them. They're looking for whatever they can do to help them make that adjustment away from an opioid medication or a pain reliever. And needling can be kind of one of those things that can help with that too. And just as a side note, just so you know, aerobic exercise is another one that releases those endogenous opioids. So if you're dealing with chronic pain, 20 to 30 minutes of brisk walking 4 to 5 days a week will help. And if you can push it harder than that, then that'll even help more. Running 6 miles gives you the equivalent of 10 milligrams of morphine. If you were to go in the hospital and they would give you 10 milligrams of morphine, running 6 miles triggers that much release of your own bodies. And so that's a tangent right there, but I like to tell people that because, a lot of people in the United States, 25% of people suffer from some form of chronic pain. And they don't necessarily realize that their body can make pain relievers for them if they can get their exercise level up enough. It'll release that, and that could be really helpful. So anyways, any other questions? We've been here about 45 minutes, so I didn't think I would make it 45 minutes, so that's good. But I appreciate you coming, and I hope this information is helpful to you. If you want to, see me, I did put my contact information on there. That was kind of dumb of me, but Back at Work Physical Therapy, you can search on the internet. You can write down my number, 435-213-3850. And you could schedule an appointment to be seen up in Tremont or over in Logan if you want. Or if you live down that direction, our therapist in Clearfield also does the treatment. So. Okay? All right, thank you. Appreciate it.